The CDC says 50% of people will be diagnosed with a mental illness or disorder within their life. 1 in 25 Americans have a serious mental illness, including schizophrenia, bipolar disorder, or major depression. According to Rural Health Information Hub, 18.7% of those living in non-metropolitan areas have a mental health condition. To bring this closer to home, according to the 2018 Kentucky Incentives for Prevention Survey, also known as KIP survey, which is given to students between the 6th and 12th grades, students in one eastern Kentucky county indicated more suicide attempts in the 12 months prior to the survey than their counterparts in the rest of the state and/or nation. Data also indicated feelings of hopelessness, worthlessness were higher within this group in relation to their peers in the same grades at regional, state, and state levels. It goes without saying that the ramifications of the COVID-19 pandemic has only magnified those feelings for many. The issues that result from unmanaged mental health range from mild to more severe issues, such as employment, homelessness, suicide, incarceration, poor physical health, and shorter lifespan. These factors may also lend to poor mental health, as each of these falls under social determinants of health. According to the World Health Organization, mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. The CDC includes emotional, psychological, and social well-being in their definition of mental health. However, in our society, mental health is often associated with negative connotations, such as weaknesses or making excuses. No one would ever call someone with a heart condition or cancer diagnosis weak based on their physical health diagnosis, or shame someone with diabetes for taking the medication they need to control their situation. This stigma of mental health and the services to treat them often keep people from pursuing the treatment they need to overcome or manage their mental health symptoms. This is only one barrier to access regarding mental health services. Cost is another barrier to mental health services. Although the value of mental health is increasing, many insurances still don't cover services. This, along with an overall lack of insurance, prohibits people from seeking treatment. Cost extends beyond payment for the services. It also encompasses transportation and the need for work leave. This challenge is enhanced in rural areas where there's not a strong infrastructure in regard to public transportation, and even with a car, the individual may not have a budget that includes the extra mileage, which could be significant in a geographically isolated area with few resources. To compensate for this challenge, many agencies have gotten creative with service provision in rural areas. An additional obstacle to specific to rural communities is the concern for anonymity regarding mental health services. In towns where citizens are familiar with or have a connection to almost everyone living in the area, many don't feel they could access services and maintain their privacy. And, as discussed prior, transportation and lack of resources may limit the choices of where they receive their services. In addition to the issues mentioned, limited number of mental health professionals and resources in rural areas is often not adequate to meet the need. Availability of mental health resources remains a challenge for those living in rural areas. As identified by Rural Mental Health Issues, Policy and Best Practices by Dr. Jackson P. Rayner, more than 1/2 of all counties in the United States do not have a single psychiatrist, psychologist, or social worker. This shortage is amplified in rural areas, with greater than 85% of mental health professionals shortage areas being in rural communities. My greatest experience with this was when I was working with a federally funded grant in 1999. We had approximately 25 positions to fill across 3 counties in southeastern Kentucky. With an area who doesn't have a lot of job availability, this was a lot of jobs to fill. At no time were we able to fill all the positions. Those agencies are facing the same obstacle more than 20 years later. Educating ourselves on these barriers to access among rural communities is the first step. As mindful, compassionate, and aware providers, we have to translate this knowledge into active citizenship and work to decrease the mental health disparities for underserved populations.